Are you still not vaccinated and still see no need to vaccinate? Would you get the COVID-19 vaccine if your GP was administering it? And is legislation mandating COVID-19 vaccination a human rights infringement? Hello and welcome to the show. I'm your host, Dr. Musam Tomene, and signing with us today is Trifosa Mpelengwe. On Vital Signs, we focus on calls to allow GPs to administer COVID-19 vaccines and mandatory COVID-19 vaccinations and the human rights thereof. Coming up on the program, we listen to views from GPs giving their opinion with regards to being allowed to administer COVID-19 vaccines, and we'll listen to public views on mandatory COVID-19 vaccinations and the human rights that come with it. We'll speak to Chairperson of South African Medical Association and Acting Chief Director at the National Department of Health about summer's call to government to allow GPs to administer COVID-19 vaccines, and we'll continue our conversation with Acting Chief Director for the National Department of Health about mandatory COVID-19 vaccinations and the human rights thereof. Remember that you can be a part of the show by asking the guests that we have the questions that you have in your mind by simply sharing your views about what we're discussing today. The number to call is 011-714-5861 or 011-714-5877. And of course, we're also available on social media. Use your phone right now and get a hold of us on Twitter. It's at SABC Vital Science, or Facebook, SABC Vital Science. The show continues right after this. Welcome back. This is Vital Signs. Now, the South African Medical Association, SAMA, is calling on the government to allow general practitioners to administer the COVID-19 vaccine in South Africa. Now, how will this be implemented, and what are the views of GPs on this? Take a listen to some of the issues that were raised by GPs with regards to administering the COVID-19 vaccines.
This is an exciting opportunity for our patients because initially when the COVID-19 vaccine rollout program was started, our patients used to come to us inquiring about, "Doctor, will you not be administering the vaccine?" Because they didn't want to go to the long queues and they didn't want to go to the government sector, especially the medical aid patients. Plus, the patients wanted the jabs to be administered to them by someone that they are comfortable with and know and rely on. For instance, our patients come to us for flu vaccines, so why not with this COVID-19 vaccine jab? Why aren't the GPs being allowed to also administer these jabs?
When it comes to the issue of the GPs administering COVID-19 vaccines to the community, we welcome it, we support it. It's long overdue, as we have noticed that the big pharmacies, in collaboration with the government, they've started this long time ago, including the NGOs, which are funded by the Solidarity Fund. As long as they are going to handle this the same way as in the government sector and other sites that are issuing vaccines, by providing the vaccines to the GPs. The big problems that we're going to face is when they expect the GPs to open an account to buy the vaccine, give it to the patient, and wait for their payment either from the government and the medical aid. And with the experience that we have as the GPs when it comes to the payment from the medical aid, we are not confident that we will be paid and being paid in time. Secondly, as they're gonna pay us 80 Rand per patient per vaccine, it might not be worth it for some of the GPs, especially those who have busy practices. But the fact that the GPs have to buy these vaccines themselves and to wait for their payment, this doesn't sit well with us.
Would they give us some sort of indemnity, for instance, if a patient suffers from side effects from this COVID-19 vaccine? Because at the end of the day, we are worried about our name as a whole. Because if I had to administer a COVID-19 jab to a patient of mine and then they develop side effects or end up going to hospital or dying, it won't reflect as it's Dr. Mabaso who gave a COVID-19 vaccine. It will be Dr. Mabaso gave someone a jab and then they died. So will we be indemnified if certain issues like these arise?
After the break, we speak to Chairperson of the South African Medical Association, Dr. Angelique Coetzee, about summer's call for government to allow GPs to administer these COVID-19 vaccines. Stay with us. Welcome back. This is Vital Signs. Now, the South African Medical Association is dismayed at reports that some healthcare workers, including doctors, have discouraged patients from getting COVID-19 vaccines based on doubts about vaccine safety and effectiveness. We're joined by Dr. Angelique Coetzee, who says that the medical fraternity must be united in its commitment to ensure wider access to vaccines. This, she says, must be based on spreading accurate, evidence-based information, dispelling any misinformation, and overcoming vaccine hesitancy, which threatens the goal of achieving optimal vaccine coverage. Dr. Angelique Coetzee, Chairperson of SAMA, is joining us to tell us why the medical fraternity must be united in this commitment. Good morning, Doc. How are you today?
Good morning, and a good morning to all your viewers out there, and may we all have a blessed 2022.
Lovely. Yeah, let's jump into it. Let's speak about the initiative that SAMA wants to take on, making and putting vaccines also in the hands of GPs. Tell us how you came about this and why you want this to happen.
So it's not that national. I just need to make it clear that it's not that National Department of Health doesn't want GPs to distribute the vaccines or, to be part of that. It is a process problem. And that the problem starts right at the beginning, where we as general family practitioners or any other doctor who wants to administer these vaccines, we need to register on the master facility list. Then, and that's the first step. You have to register. You need to identify a facility representative. That person needs to register. We need to get a password and login details. That's the first step. Now, 9 months later, we actually gave up the 11th month last year. The the master facility list can still not verify the rep of the practice. No password can be issued, with no communication then to the applicants to update it. So that's the first problem. And the details of the registration process to where the representative should provide their details is very, very limited, and it's not even, the fields are not sufficient for the verification. So that's a problem. The second very, very important problem is you need a curator to verify the site details. In this case, the HPCSA is our governing body, and they should be the curator to verify these sites. So HPCSA declined. The Office of Health Standards declined. So even though we will be getting registered on the master facility list, God knows when, we still have a curator problem. So that's the two biggest. This is the beginning, the first steps of getting doctors registered. So if National Department of Health doesn't fix their master facility list, that will also be used going forward for NHI. You cannot even register the GP sites. How are we going then to get GPs registered to do national or universal health coverage for NHI going forward? It's a huge problem. So it's been blocked, and we call it 0.0. We can't even get past 0.0. And this is unacceptable.
So you've mentioned a few of the big issues that are contributing to this issue of not having, GPs getting registered, the master facility, and of course you've mentioned that no one wants to be able to go out and curate these sites. Outside of these areas, what specifically can be done, especially about the issues of the site curation, to assess and, of course, address this issue?
Well, Dr. Unban Pillay from the Unity Forum of Family Practitioners, of which we are all part of, they did implement it or gave certain solutions, but it was not accepted. So we need to go back to the drawing board, and we need to sit with National Department of Health. They need to fix their problems. We need to listen, or they should be listened to us, and they need to understand that when we are giving you solutions, do not say it's unacceptable or we suspend this, we're not going to go further. Please engage with us and let us sort this. If you don't do that, you're going to lose your GPs. And we can look at this at the current vaccination rates. It's not where it's supposed to be. We're never going to get the targets that's been set out there. Not even the World Health Organization targets is going to be reached going forward like this. And there's a lot of patients that we have seen when they come into your surgery and you ask them why they're not vaccinated. It's not that they're so much anti-vaccines. It's just that they don't have time or they're still thinking. But I can promise you, if I have a vaccine in my surgery and I say, listen, I have it here, can I quickly jab you? They will allow me to do that. So we're losing a big cohort of patients, especially those patients with comorbidities that you can actually motivate in your surgery. And if you look at the data out there, people does trust their GPs much more than the politicians.
Okay, so with respect to the next step, so let's say they sort out this whole master access and getting sites curated, and then now GPs are then given the go-ahead to go out and give the vaccines. What is the next step? How does one, in theory, according to your plan, get to giving their patients vaccines?
So what you then need to do, you need to look at the cost of breaking those packs, because no GP can afford a pack that costs you 600,000 Rand, and you then have a limited time to administer those vaccines before it expire. So you then need to have certain points in communities, whether it's driven by National Department of Health, or in this case it would be actually more provincial Department of Health, whether it's driven by Business for South Africa, all of us work together, even if you work together with your local hospital, where you then say, Dr. Kutsia needs to order 20 vaccines today. We make sure that the cold chain is being kept. I get my 20 jabs. I make sure that I use those 20 jabs today. And tomorrow, if I need nothing, then I don't order. So you need to look at at what is the need of that community, and how many patients can the doctor motivate to come in and use it and go and collect your next delivery from wherever you're supposed to do. That can work, because you won't have access vaccines. You know that everything is being pre-packed for you, no spilling, no wasting, and just get the job done. We have done this many times before. So if I want to, give you a tetanus shot, I buy 3 or 4 tetanus ampules. It lies in my fridge. The moment when I need it, I just give it. There's really not a problem for doctors to do vaccine immunization. That's what we have been done. That's what we have been trained for.
So let's talk around this issue of the EVDS system and, of course, the vaccine certificates that the people would need to get. Are there plans that you've made in order to, introduce this sort of thing? So if I'm coming in for my flu, for instance, and I see you and you manage to, motivate me to get my vaccine on that day, but I haven't registered on the EVDS system, how will I go about getting my certificate at the end of this process?
Well, I need to register you on site, just as what they do if you go to the hospital or to the pharmacy. So you need to have the EVDS system. Therefore, you need to get registered on the master facility list, so that it opens all these avenues to you. The other thing that is interesting is if the patient is sitting in front of me, normally if it's your bona fide patient, you will have all the right ID number, the right geographical information that's actually needed to load into the system. Because a lot of the problems that we now see with the pharmacists and some of the hospital groups is that the data, either the ID is wrong, or the data, that the demographic data is lacking. There's a problem there. But from a general practitioner side, this is, we know that should be in place. Otherwise, we can never send an account and never get paid to any medical scheme if your demographics are wrong. And, the medical scheme number will be right. All of that, you can do it on site. That is, it's as easy if a new patient come in, you quickly register that patient.
So what are the next steps, Dr. Coetzee? What are we doing and how are you going to make sure that we get the vaccines in the GP's hands?
So first of all, National Department of Health needs to relook at their master facility list. They need to make it accessible for general practitioners. We need to get a curator. Even if SAMA with the Unity Forum for Family Practitioners, even if we are working then together, and if our body, Health Professionals Council for South Africa, not willing, Office of Health Standards are not willing, then National Department of Health needs to accept that we as GP leaders will then take that responsibility over. And they should not put a lot of resistance in our way to get this done. Then you need to, so once if the site is being registered and there's oversight and there's all the problems being sorted, and we know, as I've said, we know the problems. If that's been sorted, then you start to say, okay, how can we get the stock in? And then we start monitoring the GPs and start getting this ball rolling. Because, as I've said, it is important to get a jab into each and everyone's arm. But the current vaccine rate is far too low and too slow.
All right. Thank you so much, Dr. Angelique Coetzee, for joining us today, speaking on behalf of SAMA and what they would like to achieve with respect to getting the vaccines into the GP's hands, all the issues that they're currently facing with respect to doing that, and, of course, the plan that they have going forward to make sure that you are able to get the vaccine in a place, from a place, and, of course, in the area that you think will benefit you the most and, of course, take the least out of you. From this, of course, we'll continue this conversation. We've got the chairperson, or rather the National Department of Health, ready to speak to us on this issue. And of course, we'll be looking at vaccine mandates. So move a muscle. We'll see you after this break. Welcome back. The Department of Health had initially hoped to vaccinate at least 67% of the adult population by the end of 2021, but the vaccine uptake has been dropping. Could the call for GPs to be allowed to administer the COVID-19 vaccine help increase this number and get people vaccinated in order to reach that 67% that government has targeted for herd immunity? To give us some further clarity on this issue and, of course, the feasibility of what we're discussing today, we're joined by Dr. Leslie Bamford, the Acting Chief Director of the National Department of Health. Good day, Doc. How are you today? Nice to see you again.
Good morning, and good morning to the listeners.
All right, so I think let's jump into it. Where do we currently stand? What are the numbers? What are we looking like with respect to these vaccines and the vaccination numbers?
So yesterday we passed the milestone of having administered 29 million doses of COVID-19 vaccines. That is a substantial number, and we are very grateful to everyone who has participated in that process. However, as you correctly point out, we would have liked to have administered far more doses. So currently we have reached 45% of adults in South Africa, and we would very much like to increase that number. We know that we have now reached 2/3 of adults 60 years and older. So we're very pleased with that, because it does indicate that we have protected those who are most vulnerable in society. Of course, we would love to reach the remaining 1/3 of those older people. But we are also now, we will increasingly be focusing on the younger age groups, the 18 to 34-year-olds, where coverage is still only approximately 1 out of every 3 people in that age group have been vaccinated. So we certainly will not lose our focus on the older persons, but we do also increasingly need to target and reach younger people in the population.
Speaking about younger people, there's a tweet here that has come through that kind of speaks to this idea from Zanele, saying that Sanbonani Vital Signs, I took my 12-year-old for a vaccine, but I ended up vaccinated, although I'd failed to register him online. And I haven't received any SMS confirming his vaccination. Why is it so difficult for below 18s to be registered? Basically, that's the question. So I think two issues here, really looking at the idea of, getting the vaccine, at least that's good, but the issues of admin around it. What is making admin so problematic sometimes that people are finding?
So I'm not quite sure about the story, and we should follow it up because that doesn't sound right at all. So in terms of getting vaccinated, there are two options. People can register online ahead of time, and of course there are some advantages to doing that. However, people can also present at one of our vaccination sites, and they should be registered on site and vaccinated immediately. So it sounds as if that's what happened in this situation. However, if someone is registered and is vaccinated, irrespective of whether they were registered ahead of time or at the time of vaccination, then they should receive an SMS confirming the vaccination.
Do you think it would be beneficial in this case for the person to head back to the facility that they went to, or I guess any facility, and get on the system to try to figure out what went wrong? Maybe it's the wrong ID number or name or, something administrative like that. Yeah,
so we would certainly encourage that. Probably the best thing to do, if this is reasonably easy, is to return to the site and confirm with the site that this, I think it's a child, was vaccinated was registered on the EVDS and the vaccination recorded. The other option would be to phone our call center. Our call center can certainly assist with making sure that the information on the EVDS is correct, and if the vaccination is recorded on the EVDS, and I must stress it is the site's responsibility to record that vaccination, then they can resend the SMS.
All right, great. I hope that Zanele gets the answer that she's looking for there. Let's continue our conversation. This issue of not hitting the numbers. I mean, as a government, you'll always have targets that you want to reach, but at the end of the day, human beings are human beings, and they're the ones that have to take it upon themselves to walk into these facilities. So 1 in 3 in the under 18 population, as you described, and that 40-something% that you'd also spoken to. But what's contributing to people not wanting to walk into facilities and getting the vaccines?
So I think this is something that we are trying to understand on an ongoing basis, and we don't have perfect information, but we certainly have some indications. So, what motivates someone to be vaccinated? So they need to understand or feel that there is some value in being vaccinated. So they need to have accurate information. They need to not be influenced by misinformation. Many people also need a little bit of a nudge, maybe advice or assistance from someone who they know and trust to help them to make take that step of being vaccinated. Vaccination is something that's new. People might be anxious. And so, as I say, increasingly, it does seem that people want information not from myself or yourself on TV, that clearly plays a part, but also from someone that they know and trust, maybe a family member, someone in their church, maybe someone at the school that their children attend, maybe a healthcare worker. So we need to work on having mobilizing many more people to become vaccination champions. And then, of course, we do need to work at making the vaccinations as accessible as possible to people, so that it is as convenient and easy to vaccinate as possible.
Now, you've mentioned something, this issue of information, that there's a lot of misinformation that exists. And of course, how we counteract that or should counteract it is with the right information. So what is the department doing with respect to getting the right information out there, whether it's about vaccines, whether it's about COVID in itself, and whatever else that we may need to get the information into the right hands?
So we have what we call our demand acceleration strategy, which has quite a number of arms. So one of those is obviously around communication and using as many different media, as many different channels, as many different messengers as possible to spread the correct information about the vaccines. The second, I guess, main arm of the strategy is looking at incentives. So we have done some work with some, although not enormous success, around supporting older people with vouchers. And we will be looking at some incentives for younger people to give them that reward for vaccinating, just to make it worthwhile and reimburse them or compensate them for the cost, whether it's a taxi fare or simply their time that they spend in getting vaccinated. And then, of course, thirdly, there is the issue of vaccine mandates, of whether it can become a requirement. A vaccination can become a requirement to access certain settings, such as we know that certain institutions of higher learning have put vaccine mandates in place. We know that some workplaces have put mandates in place. It's a complicated issue, and it is being debated and discussed. But I think it is likely that we will see more vaccine mandates. But I think quite how far those will go is still an issue that is yet to be decided.
Dr. Bamford, I think we'll continue our discussion on vaccine mandates after the break. But before we go off, I think this issue that SAMA has raised, this idea of finding it difficult and all the hurdles that they've had to go through in order to get some of their GPs registered to possibly give out the vaccine. Is this an issue that has been raised with you, and how are you solving this?
So we are aware of the issues. Let's talk about the two issues that Dr. Coetzee raised. So the first is one that we have discussed, and I must admit, where I'm sitting, I still can't really understand why there's a problem with GPs registering on the MFL. We have registered many thousands of sites. We know that there are about 3.5 active vaccination sites currently. Those sites have all registered. We add new sites to the MFL every week so that they can. And it is an administrative process, but many sites seem to be able to navigate that administrative process. The second issue is a much more thorny one, the issue of curatorship. So all vaccination sites, the details have to be verified. We have worked very closely with the Pharmacy Council, and they have verified, for example, the pharmacies that have been very active in providing vaccination. We have struggled to identify a body that is prepared to verify the details of general practitioners. My understanding is that there have been some discussions with SAMA to do that, and it's very encouraging to note the comments from Dr. Coetzee that SAMA would be prepared to play that role, and we are certainly prepared to discuss with them that possibility and see if that can unlock what is an administrative but is nevertheless a very important step. We cannot supply vaccines to anyone who puts up their hand and says, I'm a GP. We do need some verification process to verify that that person actually is a bona fide general practitioner and meets the regulatory requirements required for vaccinating.
All right. Look, we're going to continue our discussion. Of course, we're talking about vaccines today, and that's what it's all about. After the break, we'll continue our conversation with COVID-19 vaccines. And of course, this time we'll be talking about mandatory COVID vaccines and the human rights that live there. Before we go away, of course, let's hear what the public has to say about this.
So njengamanje most abantu bavaccinated abanye abafuni. But emsebenzini abakabikho into abayishoyo ngokuba force ukuthi aba-vaccinated by force. Yilo nayilo othandayo oyayo uyo-vaccinate.
For us to control the pandemic, we have to have vaccination. That's the science that we are following. Forcing people could not be the right thing. However, people themselves must realize that the only way out of this outbreak is vaccination.
They can't force people to do what they do not want to do, you know, because at the end of the day, we all have rights, and everybody has the right to their own choice. That's what I believe. And it's so sad that now we're being forced to actually take the vaccine with our own conspiracies in our mind, you know. But if it's for the best of our country, I think maybe we should just do it, you know.
I don't think it's right. I think it's a violation of people's rights. Yeah. Because everybody has a right to refuse whatever thing that he believes is not good for them.
The right thing for government to do is to encourage people, is to work hard to convince people so that they can do that through their heart, not by force.
According to me, it's not fair for people to lose their job, whether they should be vaccinated or not. I think it's human rights. And another thing is that one is within a position to want to vaccinate or not. Currently, I'm vaccinated and I've seen the effects of the vaccination, what it can do to one's body. And another thing, I've yet to see what it can do to me over a period of time. So for people to lose their jobs, not to having to have vaccinated, I don't think it's fair. And I don't think within the labor practice, even the labor mandatory and regulations, it's not fair for one to be dismissed having to have not vaccinated.
I'd call it hypocritical because when the vaccines were introduced in South Africa, it was said that it won't be mandatory nationally, but then suddenly now you have to get vaccinated in order to access your job or go to school or all this other stuff. And as much as, yes, the vaccine, the efficacy is debatable and whatnot, people should still have their own opinion and use their own discretion in terms of using the vaccine.
It's unfair when it comes to the work environment because as soon as you sign a contract, if ever so you are bound to it, you have to do 1 and 2 and 3. The reason I'm employed to a certain company that I'm working for is because of they needed the qualities then to give them.
Of course.
So now my work is only practical. It has nothing to do with my personal. Let's say for instance, COVID, I hear a thing. Then what happens if ever God decide that okay, can I high blood and then I'm not going to take medication for high blood? Will they fire me?
Can we also
what happens if ever in an accident they give us
yes.
Are they going to fire me?
Yes, and
as
also,
long as I'm able to work with my hands, what more do they want?
There we go. And also let's not forget the amount it costs for us to even test for that COVID. So who test also more medical 850.
Yeah,
just
is.
For me to be admitted 850. So 850 the whole week just for
it's not going to work. And the sad part about it is that when the president got the COVID vaccine at first, he said it's not compulsory.
Yes, all of a sudden
what happened? What happened? Can we go back? Can we go back to the president's statement when he said it's not compulsory? Yes. When you want to take the vaccine, you'll take the vaccine.
And now
what happened?
Hausanyaki, haonyaki. That's what the ladies were saying there. Well, there's been extensive public debate around mandatory vaccination. Some businesses are likely to deny services to those who aren't vaccinated. Businesses, universities, festivals, organizers, as well as many other people are now imposing new rules that will see that if you're not vaccinated against COVID-19, you'll be excluded from their premises or events. On this segment, of course, we'll be focusing on the issue of mandatory vaccinations. We're still joined by Acting Chief Director of the National Department of Health, Dr. Leslie Bamford. Dr. Bamford, let's continue our discussion. And before we do, I think it's important to address what mandatory means versus what compulsory means. Can we look at those two issues as we get into this discussion about human rights?
So I think this clearly is a very hot topic. So there is no way that we can make vaccination compulsory. You know, that we might. There is no mechanism for that. That people would be compelled to be vaccinated. However, I think it is a very important and clearly very lively debate. This debate about vaccine mandates and the extent to which it is allowable or advisable and beneficial to limit access to certain events or certain settings to people who are not vaccinated. Mm-hmm. So I think there are arguments for it. So one issue is around whether I choose to protect myself or not. But there are issues around the fact that although we know that people who are vaccinated can still transmit the virus, can become infected and transmit the virus, the risks of doing that are much lower compared to unvaccinated people. Compared to vaccinated people. So someone who is unvaccinated in a workplace does pose a risk both to co-workers and to members of the public if they are working in an environment where they are in contact with members of the public. Mm-hmm. So that, I think, really is balancing, and that's at the heart of this debate, is how do we balance a person's individual rights to choose for themselves against their responsibilities to people around them. Mm. So we know that all the time, certain things that people might consider to be their rights, there are limitations placed on that. When that is reasonable, when it is in the public interest, and when it can be implemented in a fair way. Mm. So as I say, I don't think we have all the answers. Obviously, as a vaccination program, we have a keen interest in vaccine mandates, but this is a process that involves that is being led from outside of the Department of Health and involves other government departments, many other stakeholders. Mm. So I think it's a process and a journey. We acknowledge that it was initially said that vaccines were not mandatory, and to date they are not mandatory. But I think this is something that is evolving over time. And as the context changes and as our understanding changes, there may be need to change positions and to implement vaccine mandates. Mm-hmm.
So what do vaccine mandates look like with respect to the government's view on a very practical guide to what the vaccine mandate would look like?
So I think some of the details are still, I think both the principles and the details are still being debated. Mm. So sometimes it's something simple like limiting admission to an event such as a sports match or a restaurant to people who are vaccinated. And then I think moving on to other settings, and I think different settings have different contexts and maybe different issues that need to be dealt with. But we also know that in some instances, workplaces have implemented mandates and required people to be vaccinated. And so I think vaccine mandates, there's no single way that they look, but that they are tailored to different circumstances and settings.
Mm-hmm. So with respect to this idea of mandatory vaccines, do you think there is a different option that can be considered to address the issue of getting people vaccinated? I know we've softly spoken on it before. Of course, you want to increase the number of people that are volunteering themselves to get the vaccine, but there are other ways that we can come up with to make sure that people get the vaccine without necessarily being coerced by a mandate.
So I think until now, that has really been our approach, and it continues to be our approach. That we would very much like people to come forward voluntarily and be vaccinated. We believe there is a very strong case for them to do that, both for their own health and for the health of those around them. Our approach, as I previously indicated, is to try and persuade people to, where possible, provide some incentives or rewards for them to vaccinate, and to make it as easy as possible to vaccinate. Mm-hmm. You know, beyond that, of course, each of those we can do better, but they aren't really any other options. Either you have to persuade people to vaccinate, vaccinate voluntarily, make it as easy as possible, reward them if possible. But those are really the strategies that we have at our hands.
All right, Doc, we've got a caller, Octavia from Roodepoort, who's got a question. Octavia, good morning.
Good morning.
Yes. What is your question?
In fact, I don't have a question.
Okay.
I really feel and strongly suggest that it should be a voluntary thing, because I have had a nasty experience in the sense that my husband was vaccinated on the 24th of June, and I had asked him that he should wait until we are sure that the vaccination is okay. He was well, there was nothing wrong with him. So he got himself vaccinated. When he came back, he was okay. 1 week passed, but suddenly in July, on the 11th of July, he started saying he's having a sore throat. But having said he's having a sore throat, I became worried, because I also now felt the body pains. And then I was saying to him, you know what, you have vaccinated and I haven't. Is there not a possibility that I can find myself infected since now you are having this vaccination? So as we were talking about it, I felt, let me rather go and have before I say anything.
Okay.
I went and had a test. It was on a Sunday.
Okay, Octavia, I'm going to need you to get to the point very quickly. We don't have a lot of time. So what point are you trying to make? Yes.
All right. So to the point is that suddenly I also became ill. My husband was ill only for 2 days, and then I died. He died after 2 days. When the results came after I had done the test, I was now having COVID.
Okay.
So how can you encourage me to go and have a vaccination? That is my point.
What do you think the problem is with the vaccine, ma'am? I think I should ask you the question that way. What do you think the vaccine caused your husband's death a month after he got the vaccine?
I suspect. Because he was well. It's unfortunate that when he died, he was not examined. But I got COVID.
All right.
And I had gone nowhere. I was around with him.
All right, that's fine. Let me throw the question to Dr. Bamford. Dr. Bamford, I think you've heard the story. What do you think is going on here, Dr. Bamford?
So I think, first of all, obviously, this is an unfortunate set of circumstances, and I think we would extend our condolences to the caller for the loss of her husband. We know that vaccines do not work 100%. We heard that the person was vaccinated. I'm not sure if they were fully vaccinated. That would have depended on which vaccine they received. So we do know that people experience what we call breakthrough infections. And this sounds as if, unfortunately, this was a breakthrough infection where, despite the person being vaccinated, they contracted COVID-19 and they did transmit it to the wife, but also that unfortunately they passed away from COVID-19. So clearly that's a very unfortunate set of circumstances. But the fact remains that we know that people who are vaccinated, and particularly people who are fully vaccinated, are far less likely to develop severe disease and death from COVID. That does not mean that someone who's vaccinated cannot develop severe disease, but the chances are much, much smaller. We know that during the fourth wave, the majority of people who were admitted to our hospitals with COVID-19 were unvaccinated. So I think that's my response. The vaccines remain effective. They remain safe. The effectiveness is not 100%. But if people are not vaccinated, then their chances of contracting disease, and particularly their chances of developing severe disease and dying from COVID, are much, much higher if they are unvaccinated versus people who have been vaccinated.
Thank you so much, Dr. Bamford, for joining us today and really covering the topics that we're really looking at today. And that, of course, was around this idea and this issue of vaccine mandates. You know, addressing this issue that mandate does not mean compulsory vaccination and things such as that. And, of course, looking at this idea that SAMA wants to go out and get vaccines into GPs' hands. Thank you so much for joining us today and having this journey with us as we looked at COVID-19 vaccines. Make sure that you do join us again next week as we'll be covering another topic that will help you and may just make you more informed. From me, Dr. Musamtomeni, this is Vital Science.